Racism and discrimination are fundamental determinants of health. Racism and discrimination impact both mental and physical health across all stages of life, from childhood to adulthood to old age, and even reaches across generations where people suffer the consequences from racism and discrimination against their parents and their grandparents. Importantly, these systematic, unjust and avoidable differences in health and in access to healthcare services, these inequities in health between groups of people that are being discriminated against and those who are not, exist independently from socioeconomic factors, and the evidence for that is increasing by the day. Yet the issue is insufficiently addressed in the public health domain, and that is what brings me here today. So my name is Raymond Geeman. I'm a Senior Policy Manager for Health Equity at EPHA, European Public Health Alliance. But today, I'm not speaking on behalf of EPHA, but I'm speaking on behalf of about 40 organizations which operate across sectors, and about double the number of people who work for these organizations, who have come together in a network called DisQo, which stands for Anti-Discrimination and Health Equity. And these people, some of them are here in the room with us today, are all leaders. They are driven by strong values and a passion for social justice and equitable societies. They recognize racism and discrimination as fundamental determinants of health, and they are committed to take an active stance against the issue. They are anti-racist and they are anti-discrimination. Such leaders we have also engaged with across the European institutions and international organizations, including the WHO, the OECD, the European Parliament. Some of its members have endorsed the joint statement that I will be presenting to you today, and various DGs and agencies across the Commission, including, of course, DG Justice and Consumers, Fundamental Rights Agency, the Joint Research Center, Eurostat, and also DG Sante. This is to say that while we are here to address a serious issue and to put it on the agenda, which has been insufficiently there, or at least not high enough, we do recognize, embrace and support the actions that are being made. The most obvious case in point, of course, is the support for the DisQo network, which was selected after review by colleagues from DG Sante. What I'm presenting to you today is the outcome of an extensive participatory process that included several meetings with the network and regular meetings with the DisQo core group. So this core group was established at the very start of the network and consists of people with different backgrounds, expertise and experience who were willing and able to dedicate more time to the running of the network. The preparation, the facilitation of the meetings, the webinars, and also the drafting of the joint statement. Not only has this core group ensured that the joint statement became a well-balanced document that is accurately reflecting the current stance on the issue, they actually have been instrumental in the entire running of the entire network, for which I want to recognize and wholeheartedly thank them today. Some of the key priorities that are included in the joint statement that I will come to in a moment already surfaced across the virtual discussion tables at the kickoff meeting, and they have been the basis for 3 webinars that we organized in the context of the network over the period January till March. And these were opportunities for us to engage with a wider network and also to delve deeper into some of these topics. The first one was about the importance of language, definitions and narrative to establish safe spaces for constructive dialogue. For example, when bringing together people from different backgrounds who might have different levels of understanding on the topic and who might be more or less familiar with the specific jargon. So these safe spaces are spaces of trust and spaces in which it is okay to make mistakes discussing this topic, as long as the intentions are the right ones. In the second webinar, we explored the topic of equality data, a topic, I admit, that becomes more complicated once you start to know more about it. However, it's a nut that needs to be cracked, because equality data are the fundament for evidence-based policy making. Then our last webinar was about taking action. where we went from the EU level, where we had Michaela Moa, the Commission's first anti-racism coordinator, who spoke about the EU Anti-Racism Action Plan, all the way to local, with a presentation from a Dutch local publicly funded organization in the Netherlands working on equal treatment and non-discrimination, supporting victims of discrimination and training professionals. So these webinars and also the joint statement, they can be found on a dedicated webpage, and I encourage you to have a look at these. Okay, let's move to the joint statement. As I mentioned before, it is the outcome of a participatory process with multiple rounds of revisions to ensure that it really reflects the position of the network and not that of the authors, which I think is reflected by the vast majority of network members who endorsed the statement. And those who have not endorsed it are either still in the process or they are public or international organizations who cannot endorse such statements or which have very long and complicated procedures in place to do that. So the joint statement, just as a quick explanation, it identifies 5 key priorities. And each of these priorities, they start with a short introduction with references to key publications, policy documents, scientific articles, and is then followed by a section stating our commitments as a network and also what we envision the Commission could take stronger commitments on. Now, before going briefly through these 5 priority areas, I wanted to mention a few points. Firstly, we have been informed by you, by DG Santé, on a few occasions that these joint statements should not be wish lists. For that reason, we have described priority areas to indicate that within these priority areas, we all stakeholders have a role to play. Now, if you look at it, maybe from the Commission side, critically, you might still read it as a wish list. However, if you do, we want to say that for each and every wish, we are there as the network to provide support, to provide solutions, and not to criticize. And in fact, one of our identified priority areas is about participation. Secondly, you can see in the joint statement that we are addressing the European Commission and not DG Santé. The very call for proposals for these thematic networks was about taking an intersectoral approach, which we have done. This is reflected by the diversity in the network of organizations, but also by the joint statement itself. And also, it does not make sense to address an issue that cuts across society and across policy domains to only address DG Santé. Thirdly, and related to the previous point, is action is required at all levels, at EU level, at member state level, regional and local. We are targeting this statement to decision makers at the EU level, but recognize that action also at a sub-EU level is needed. Nevertheless, this does not take away the fact that there are some areas we feel the EU, and more specifically also DG Santé for some, can take a leadership role in pushing for anti-racist and anti-discrimination action. Now, for the sake of time and also the pace of the presentation, I will not read out each and every bullet under these priority areas, but I will give you single examples within these priorities. First one, it starts with the recognition of racism and discrimination as fundamental determinants of health to allow for efforts to address it. While we as representatives of the organizations in DisQo have endorsed this statement, it does not mean that now our organizations have formally recognized the issue. Racism and discrimination are deeply rooted, and denial is a powerful force that keeps pushing back. In other words, recognition is something that we will be constantly needing to invest energy on. What we'd like from the Commission is a similar effort to take leadership, for example, from the health equity perspective. A concrete first step to address this could be the inclusion of explicit mentions of racism and discrimination as fundamental determinants of health in policy documents, such as the EU for Health program. Of course, this should not be considered a tokenistic, a tick box exercise, but as an important first step. It's about people. Too often, policies are developed without involving the people affected by these policies. Social participation, which is recognized by the WHO as one of the 4 drivers of health equity, should follow a human rights-based framework that involves meaningful engagement. That involves meaningful engagement of affected people and communities throughout the entire process, from diagnosis of the issues all the way to planning, implementation, and the evaluation of policies and interventions. To strengthen social participation, we are committed to provide thought leadership, lived experience, and concrete solutions for the design, development, evaluation of hard and soft policy initiatives. What we would like to see from the Commission is a strong commitment when it comes to stakeholder participation, as it is described in the Better Regulation Guidelines, specifically on how to address racism and discrimination as determinants of health. Language matters. As mentioned, we dedicate an entire workshop to discuss the important topic of creating those safe spaces for dialogue. Regarding definitions, we see that existing definitions are fragmented across documents and websites of Commission, DGs and agencies, and that multiple definitions might exist for the same term. To increase clarity and consistency of key definitions and to promote respectful and inclusive language, we commit to creating these safe spaces within our own organizations. The role that we see for the European Commission, besides of course creating these safe spaces within their own DGs and agencies, is to harmonize definitions and make these easily available in an overarching glossary. If you can't measure it, you can't fix it. Equality data, as I mentioned, is the fundament of evidence-based policymaking. Addressing racism and discrimination and advancing health equity requires good quality data that allows for disaggregation by indicators on various grounds on which people are being discriminated against, including race and ethnic origin. However, for multiple, these are ethical, legal, historical reasons, the data are currently not or insufficiently collected. And comprehensive systems or a coordinated approach to collecting these data in the EU is lacking. What we envision is that the EU takes a stronger political commitment to crack the nut that I was referring to earlier. And we believe that also DG Sante can push for this from a health equity perspective. We need better health equity data. The fifth and last, time for action. Tackling deeply rooted issues which cut across societies and generations requires actions at different levels and collaborations and partnerships across different sectors. This calls for the breakdown of silos and operating outside one's comfort zone and area of expertise, for which all of the previous points are crucial: recognition, language, social participation, good equality data. And silos exist across the categories, including public, private, but also within civil society. And within these silos, there might be power dynamics and structures that sustain discrimination and exclusion. And we recognize and fully support the Commission's effort to strive for a union of equality with its non-discrimination strategies. At the same time, what we see is that the implementation of these strategies happen too much in isolation. And while there are mechanisms in place that should seek these inter-DG collaboration and policy mainstreaming, such as the Task Force on Equality, we observe that these mechanisms would benefit from more transparency and stronger stakeholder participation. In summary, recognition, social participation, language and definitions, equality data, breaking down silos. Importantly, and finally and importantly, the organizations who have endorsed the statement so far, and this was the situation yesterday morning when I submitted my slides. In the meantime, more endorsements have already come in. So if you are listening to this and you feel that your organization might endorse this statement as well, please do reach out and state your endorsement and send in your logo. You can do that by the 17th of May. And then before moving on to the Q&A, I want to introduce Jacqueline Baumann-Bussato, Head of Policy at EPHA, European Association for the Study of Obesity, who is supporting me with answering some questions if there are. Thank you very much.